Hello, my name is Vimo Arumuham. I'm a consultant urological surgeon working here at University College London. I am part of the Institute of Urology Stone Unit, which is a tertiary referral service for patients with complex kidney and bladder and ureteric stones referred from around the country. So in a typical day, we might do 4 or 5 flexible or rigid ureteroscopes and 1 or 2 percutaneous nephrolithotomies, depending on the list and the availability. Our cases can vary from simple ureteroscopies, but then we also get referred from other stone units from around the country, either complex percutaneous nephrolithotomies, which people are doing less so, particularly in the morbidly obese patients. We also have a lot of single kidneys, transplant kidneys, stones in spina bifida patients and neuropathic issues. So the advent of smaller scopes with better vision has completely transformed the landscape. And I think that's the most important breakthrough for us, as the treatment pathway for medium-sized stones has moved towards miniaturized PCNL, and now the new player on the market, which is the much smaller scopes that can treat much larger stones. So there is this gray area where, depending on what your preference is, cost implications, both options may be valid. So fans has completely changed the landscape, because now we've got suction within the kidney that's deflectable, and therefore we can dust better and remove any residual stones at the time of the procedure that would have hung around afterwards, just because if we're dusting, we weren't able to completely clear the kidney if we didn't have any suction. However, there does come a slight disadvantage with a sheath if it's particularly a stone in the lower pole. You're having to use your scope around to deflect the sheath around into the lower pole and then stay in the lower pole. Often these stones can be large, and the presence of about an hour's worth of lasering with torque on that handle really gives a significant risk of damage to this scope. So 100%, if I'm dealing with lower pole stones and I'm using a flexible ureteral access suction sheath, then I will be using a single-use scope. So there are many different clinical scenarios where I'd use a single-use digital scope, and the most obvious that comes to my mind whenever anyone asks me, or a trainee asks me that question, is a large stone in the lower pole. And that's because you are deflecting the sheath and you're constantly applying a torque pressure on the scope and its inner mechanism. So if you're using a reusable optical or a digital scope, there's a lot of pressure on that, and you might be lasering for close to an hour with additional sheath deflection to get onto that. So that, in my experience, has led to scope damage, thousands of pounds worth of scope damage. So with the advent of single-use digital ureteroscopes, I don't have that problem. I use a 7.5 French or indeed a 9 French if it's a large stone and I need a lot of torque with the sheath, to basically not worry about the damage that's happening to the scope, because I'm throwing it away afterwards. Institutionally, we have about a year's worth of experience using the HugeMed single-use flexible ureteroscopes. I've personally done up to around 200. I love them. I think they're brilliant. There are a lot of scopes in the market, and I've tried the majority of the ones that are available in the United Kingdom, certainly. Things that I like about the scope is that it is lightweight. And certainly I like the fact that the lead comes out at 6 o'clock out of your operative field, rather than at 12 o'clock when you might have a basket or a laser or need an assistant to help with the access and additional help. So I really like that. The buttons are easy to press, and most importantly, the deflection does not put any stress or pressure on my wrist or my thumb, which with prolonged stone treatment, this was an issue in the past with other scopes. So all in all, I think it's a lightweight, robust scope that is ergonomically designed. So one of the most unique features about this scope, which sets it apart from many of its competitors and why I really enjoy using it, is the ability to choose the position of the laser. And that's really important because when we're dealing with left-sided kidneys, or kidneys on the left side with stones in small calyces on the left, a channel that comes in at 9 p.m. allows you the ability to use less torque to access the stone, and also allows, if you were to use a basket, allows it to go around the lip of the calyx and access the stone and get a better stone free rate in that respect. And similarly, vice versa, for stones in right kidneys, particularly in difficult positions, having a position of the laser coming out at 3 p.m. allows me to almost go around the bend a little bit, and certainly helps with if I need to incise an infundibulum or indeed get a basket around and pull the stone out. The position and the trajectory of that channel makes a complete difference, particularly in complex stones, compared to other scopes that you can't choose. And that is all for the same price. So often what I tend to do is I'll look in my preoperative planning at where the position of the stones are and where I'm envisaging problems. But regardless, if it's a left-sided kidney, I'll go for a 9 p.m. port. If it's a right-sided kidney, I'll be going for a 3 p.m. port. We're on a wave of innovation right now, and it feels like almost every year there are breaking advances in luminal endourology, and things are getting smaller and smaller, both from a percutaneous perspective, but also from a retrograde perspective. If I know a patient has a very tight ureter, either from before, or for example, if they're a young male or they've had retroperitoneal radiation, I know that inserting an access sheath is going to be nigh on impossible and risks damaging the patient. In these cases, I would like to have a 6.3 French scope in my arsenal that I could put over a wire into the kidney and laser. And I know that I'm more comfortable with this because it allows more space around the scope for at least some form of efflux of fluid, and therefore trying to maintain low pressures in the kidney. This opens up another avenue of treatment options that are available.